Hello, everybody. We have reached the end of another week here at Villa, and so it's time for me to put out another video. And this week, I am joined by a very special guest, my much, much, much older brother, Dr. Tom Giordano. Tom, how you doing?
Good, Matt. Happy belated birthday.
Thank you very much. Uh, the reason why my brother is here, it's not so that he can tell stories about me running around in my Superman underoos, or I can talk trash to him about the fact that he cannot beat me at ping pong. It is because Tom is a specialist in infectious diseases down in Houston, Texas at Baylor College of Medicine. So I thought it would be good to have a little conversation with him about what's going on in general with COVID, and also maybe some advice for us specifically here at Villa. So Tom, could you just give us a general sense of what's happening in the country at large with the virus, but also you're a good brother. I know you follow what's happening here in Western New York. So maybe talk a little bit more specifically about that too.
Well, the numbers nationally, what's happening is concerning. If you look at what's happened with this pandemic in the U.S., it started out in very small areas of the country, New York, Northeast Corridor, and a bit more on the West Coast. And then everywhere else, everyone went through shutdown, basically, pretty much across the country. And so the numbers were pretty low in most other parts of the country and got over that huge, horrible hump that the eastern part of New York State went through, downstate went through. And then the second kind of big phase of the epidemic was a wave in Texas and Florida and California. Those were, that's where when we had some terrible numbers in June and July, and a lot of deaths. Not as bad as what you saw in the Northeast, fortunately. Now and then things got better again nationally, looking at across the country. Now we're seeing another wave that's clearly hit in the Midwest and the mountain regions. And there's indications that things are starting to take off again. In Texas, the numbers are not looking, I think the numbers show that there's more cases again. Some of the numbers in other states are stable, but no longer going down. I'm worried about what's going to happen in the next few months. New York seems to be, you asked specifically about Western New York, your numbers seem to be good. The case counts seem reasonably steady. There seems to be some areas of concern, and again, downstate. But Western New York, Monroe and Erie seem to be holding steady. I understand there's been some isolated outbreaks in some of the colleges, which is sort of expected, but things seem to be in decent control there.
Yeah, we're happy with where we are right now, I think, as a community, but certainly here at Villa, we haven't had any cases, so we're very, very happy about that. As we head into the cold months here in Western New York, first of all, what do you think are some of the most important things for us to do to try to continue to keep the numbers down?
There's a couple things, and I think most of you have heard this before. There's no doubt indoor activities are higher risk than outdoor activities. And in Texas, we can do outdoor activity, at least in Southern Texas, we can do outdoor activities year round. You guys don't have that luxury. But if you have to have indoor activities, indoor events, masking is clearly important. Physical distancing, hand washing, the same story over and over again. Now, there's no magic numbers to any of this stuff, but the farther away you are from someone, the less likely you are to be exposed to whatever droplets or respiratory things that might be coming out of their mouth and nose. And the more barriers you have between you and them, whether it's mask on you, mask on them, mask on both, the safer you are. And so those things really do make a big difference.
Okay, thanks. What about the flu shot this year? Some people don't really like getting the flu shot, or, think that it actually gives them the flu. We have a clinic coming up next Wednesday where we'll have people here administering the flu shot. So how important do you think it is for people to be inoculated this year?
Yeah. Well, so I hear this all the time from some of my patients and others, that I don't like the flu shot because last time I got it, I got the flu right afterwards. And I think it is medically impossible for the flu shot to give you the flu. There is no live virus in the flu shot. So you cannot get the flu from the flu shot. Coincidentally, we give the flu shot during the flu season. And if you got the flu shot and then a few days later came down with the flu, well, it wasn't that the shot gave you the flu, it's that you were exposed to the flu before you got the shot, probably. And then it happened that you got the flu at that time. So how important is it? Well, it's always important to get the flu shot because flu kills 25 to 50,000 people a year in the US. That pales in comparison to the COVID numbers we're seeing, but it is a major killer in the US, generally people at the extremes of the ages. There's always a reason to get a flu shot. There's an extra reason now because, one, if you got the flu and you got sick, you don't want to have to go to the hospital for obvious reasons. You don't want to be exposed to people through that. You also don't want to take up a bed when someone else might need that. The other reason to not want to get a flu shot this year is to avoid it'll help you reduce the confusion in the healthcare system, be confused about what's going on if you do get sick. The flu shot does protect you against the flu. It also protects you against getting severe flu, so you're less likely to need all that extra medical care. And the other reason to make sure you get a flu shot is to protect the people around you. You don't want to have to put yourself in the question, do I have the flu or do I have something else? You'll have to stay home from work. You'll have to stay home from school. All those things can be avoided if you reduce the risk of flu this year. And so, it's just going to keep things a lot simpler if you go ahead and get the shot.
Yeah, that's great. And so again, to our students and our faculty and staff, go into your email. There have been a few emails from DJ Shear about the flu shot clinic coming up. And so we're making it real easy. You can get the shot right here on campus. Just a couple of other questions, Tom. One is about wearing masks. Sure. Our students and faculty and staff have done a really good job of wearing their masks, but a lot of people don't like them. There's been information, spread out there that somehow they might actually be counterproductive or unhealthy. So could you just talk a little bit more about wearing masks and how to do it properly? Yeah,
so mask wearing is critical. Texas, in Houston in particular, we were in a bad place in June and July, and two things happened to get us out of that. We did not go through shutdown. The governor and the local authorities did not shut things down. Did two things: shut the bars and restaurants, which are high-risk environments because you don't have a mask on and because you're indoors, and often yelling and shouting and all those things that happen in bars and restaurants. And the second thing was require masks in any indoor establishment. And it worked. We got over that hump and the numbers went down very convincingly. So the mask, nothing's 100%, but if you reduce your risk of something by 50 or 60 or 75%, that's a huge reduction in risk. And then you add in some extra other layers of protection and you've really reduced your risk quite a bit. In terms of the safety of the mask, surgeons and doctors have been wearing masks for 100 years and doing complex surgeries and open heart procedures with a mask on. So the idea that somehow you can't operate at your full potential because you have a mask on doesn't hold any water. oxygen and carbon dioxide, the things that you need to exchange as you breathe, they're tiny, tiny, tiny molecules, right? They pass through that mask like it's not even there. It is a little uncomfortable, no doubt. You get, humidity builds up, but if that's the price you have to pay to avoid getting COVID or giving it to someone else, that's worth it, in my opinion. And then, when you go outside, take your mask off for a little while and breathe and resume. And when you go back in, put it back on. I don't like wearing it, but it's the price you pay. And it's really, once you get used to it, it's just not that bad.
Yeah, and I agree. I've gotten very used to wearing my Villa Vikings mask. Tom, I'll send you one of these so you have one as a thank you for helping us with this. But it takes some getting used to, but it's super important here on campus that everyone continue to wear those. So, okay, lastly, what advice do you have for us as we head into holiday season, into the breaks, and specifically for college students? How should we be thinking about Thanksgiving and Christmas, and how we interact with family and friends?
Mm-hmm. Yeah, this is such a tough question because no one wants to say, don't have that big family gathering. But the truth is, this may be the time to really pare it down and scale back your plans, because it's all a numbers game, right? The more people you come into contact, the more your risk is. And the more those people have come into contact, the more your risk is. And you can't control what everyone else around you is doing. You don't know necessarily what they're doing and how many people they're coming into contact with. So to reduce your risk, you do want to minimize the number of people you come into contact with. Does that mean no Thanksgiving dinner? Well, you have to make your individual choices, but it would be a good time to have a more intimate dinner with just a smaller group of people. And there have clearly been transmissions linked to family parties, family events, things like that, weddings and funerals. So we do have to be careful. And again, masks give you an extra layer of protection. Coming together to eat, it's really hard to maintain masking. So it's a numbers game. And unfortunately, this year, we just need to keep the numbers down.
Yeah. And so the same would hold. College students love to congregate. They like to be together, very social. But again, we just have to be really careful about that.
Yeah, I mean, we have to make choices. This is life. We have choices to make right now. And what's more important? Having some in-person contact and not going to the bars or going to that party, but risking that things will be shut down again. And these are all choices we have to make every day, and people need to choose what's most important to them.
Yeah. Thank you for answering these questions, for your advice. So you're hearing this not from one Dr. G, but from two Dr. Gs right now. Wear your masks, get your flu shot, stay distanced. And if we continue to do those things, hopefully, we'll continue to have a successful semester here at Villa, and you'll be able to keep your family members and friends safe as well. So thanks, Tom. I really appreciate it. And everyone have a wonderful weekend, and you'll hear more from me soon. Take care.